Reducing maternal, neonatal, and child mortality remains a concern in West Africa, with figures ranging from 483 to 888 deaths per 100,000 births. Maternal and infant mortality rates in this region are among the highest in the world. In order to provide adequate responses to this scourge, several initiatives are being taken to improve the health of mothers, newborns, and children. Family planning is the key issue, including the Urban Reproductive Health Initiative. In order to capitalize on the success of the various actions and respond to the need for large-scale access, the Bill and Melinda Gates Foundation launched a global family planning program called the Challenge Initiative, TCI, in 2016.
Challenge Initiative is a demand-driven model where we do not impose on the cities. We talk about what we offer, and the cities decide that we want to be a part. When the cities come and they sign up, a city shows its commitment by demonstrating political commitment, as well as bring resources to it. So this initiative is what we refer to as a business unusual model. Because traditionally what happens is that we get donor resources, we move to a city, we implement. But this time we're saying that for you to participate as a city, you need to put skin in the game. You need to bring something to the table. What can the cities bring? They can bring their health systems, they can bring their health workers. The city can put money to the initiative such that we as the Challenge Initiative, we match the resources of the city to implement that.
We are concentrating our efforts on urban areas because, as you know, experts have been telling us, and for several years now, that more than 50% of the world's population lives in cities, and projections are foreseeing even worse, saying that by 2050 the population will reach 70% in the cities. So we also know that those people who come to migrate to the cities are not often equipped and not really knowledgeable when it comes to finance. These people are concentrated in the cities, and more often they reproduce the behavior of the rural environment. What we're trying to do is to make sure that those poor people who live in the peripheries of the big cities have the same rights and access to the family planning services that we provide. The Challenge Initiative focuses on ownership by beneficiaries. It aims to improve donor coordination and mobilize political decision makers in cities to the highest levels of government. In Senegal, the initiative coordinated by IntraHealth was implemented from 2009 to 2015 in disadvantaged urban areas through a pilot project called the Senegalese Urban Health Initiative, ISSU.
On a vu des très grands changements dans les villes.
We have seen great changes in the cities. First, we learned that there were many women who wanted to use family planning. They wanted to space birth but did not have access to the products. And in town we saw men who wanted to protect the health of their women, but these men did not have access to the information and proper services to do so, to use family planning. The biggest changes we have seen are that families can take control of their future and decide on how many children they want to have, how many children they want to take care of, how many children they can keep, how many children they can put to school.
Je pense qu'il y a 30 ans, il était difficile d'aborder cette question.
I think it was difficult before to address this issue because people did not understand it well. We thought that family planning was a matter of people coming in from outside and trying to limit our populations and so on. There was not the economic progress we see today. So I think that's the most important lever, and to tell people, listen, Africa is succeeding. Africa is starting up. It is the region of the world where we have seen economic gains, economic progress of great importance. Then I believe that today the message can be heard well. People can hear you, and it is a lever on which to play. There is also the other lever that represents young people, your generation, those who want to do well, those who gain more, who have the right talent, who have the technology, the use of technology, and young people who are eager to succeed. Young people who will not wait 50 years like our generation and past generations. They are hungry. They want to succeed right away. They want to have a family they can manage, children they can educate, etc. I believe that youth is a factor to bet on. It is an extremely important lever.
The program is part of a global campaign to give to more than 120 million women around the world access to contraception by 2020. The Challenge initiative intends to build on the Senegalese model, which has resulted in a 19% increase in a contraceptive prevalence rate in several target areas of the project. These results were achieved through the involvement of religious leaders, municipalities, groups, and women's associations. In a Muslim-majority country, religious argumentation has proved effective in overcoming persistent and convincing beliefs and resistance about the benefits of family planning.
The imams are very much respected, and they have different communication ranges, among which the Friday prayers. During this prayer, there is what we call the bayan. The imam makes a speech and is listened to by most of the men who take part in this prayer. These men are heads of households, and as you know, the family structure here is somewhat characterized by this direction by men. And if men hear the imam stating positive opinions about birth spacing and family planning, they will automatically accept it and give free rein to women to purchase modern contraceptive methods. However, if the imam is reluctant, men are also reluctant. And if the imam is open, men are open about these issues. And this is the strategy we use to make a certain network throughout the country. In all the regions where we have activated the local antenna of the network with a lot of partners, not to mention that there is a training that is done, and then there are plans of actions that are being refined.
The intervention of the religious is organized around major activities such as the public orientation sessions, religious talks, and public entertainment sessions. In Senegal, 30% of women have an unmet need for family planning, so the community approach makes it easier to access contraceptive methods. Our role is to advise women of childbearing potential. We support them from pregnancy to childbirth, and we give them advice on reproductive health, maternal and child health, contraceptive methods, and even on HIV/AIDS prevention. We find it difficult sometimes to convince certain families, but through negotiation, through clear and simple arguments, we get them to adopt family planning. They understand that is in their best interest. For each contact with women, each meeting, we try to get the same message out on family planning by explaining its importance. Why use the family planning? What is the purpose of that use? Sometimes we hear about their knowledge and the different methods of family planning. We also meet women who already use a planning method. We also meet women who have no information on this subject. And at this moment, we explain to them, we encourage them to come and start on family planning. Now, there is a certain tendency that makes men coming towards us more often to get information about family planning. These men who invite their women to use that method. Thanks to the involvement of local authorities, access to contraceptive products and quality family planning information and services is improved.
Au niveau de Dieuppeul-Derklé, il faut dire que nous disposons d'un poste de santé qui relève.
At the level of Dieuppeul-Derklé, we have a health center in the district of Gaspar Camara, and earlier we have shown the efforts and sacrifices made in that field in terms of impregnation, especially with the contributions of exceptional women's group we call Badjenugor, visiting the concessions to get the couple, the wife and the husband, to understand the importance of family planning, which allows birth space and brings comfort to the family.
Qui permet l'espacement des naissances, donc qui apporte apporte le confort au niveau de la famille.
That is why we as local community should not be left behind. We will spare no effort whenever it comes to budgeting, giving a fairly consistent path to the family planning program.
The Challenge Initiative aims to provide technical assistance to all Francophone West African countries in the implementation of programs and other interventions deemed relevant to the achievement of planning objectives family. Beyond the mobilization of domestic resources and the financing by the various technical and financial partners, the synergy of actions and the sharing of conclusive experiences are levers that the initiative intends to activate to ensure the success and sustainability of the scale-up of urban reproductive health initiatives.